Hello everyone, welcome to the second part of hip joint. I hope you must like my first part and you have commented in the comment box for any queries which you have regarding the hip structure. Do feel free to ask me any questions which you have. If in case I know the answer, I'll surely try to answer those. Now, we saw in the previous session about the hip joint, the complexity of the structures and how they are related. To understand about the symptoms or the problems which you generally feel around the hip joint, we need to understand one most important thing, that the hip can have problems from within the joint, from outside the joint, from somewhere below, from the structures here or from the structures from here. So these, I think I'll keep him like this. Okay. So to understand these structures, the symptoms, we really need to have an idea about what and all could be the possibilities. We have now been clear, if in case you have been listening to my previous classes, you would have known that ligament injuries, muscle injuries, bone injuries, how to differentiate them, and of course the bursitis, if in case it is there, how to differentiate them. In this joint, we are going to talk on a different structure today, which is one of the most commonest problem which you all face, that is nerve pains, which I have now discussed in the earlier classes. But in this class, I'm going to talk about the nerve pain because we are now very close to the spine, and understanding the nerve pains is very important because there is a very simple thing which we need to keep in mind every time, that is a differentiating factor of a nerve pain arising from a muscle compression or a discal compression. That has to be differentiated. If in case we are not able to differentiate that particular point, then every nerve pain will be considered as a disc prolapse. So we might end up doing unwanted treatment even if in case we don't have that problem. So to understand that, we'll go in detail to the nerve pain in this class rather than the other different pains. Of course, I'll be touching on other parts, but my main focus in this class will be about the nerve pains which is arising from around the hip joint. Muscle pains, of course, can be from the quadriceps muscle, hamstring muscle, or the iliotibial tract or the tensor fasciae latae, which I was talking about, the covering of the side part of the hip joint. And it could be from strain in the buttock muscles, especially for people who have been doing a lot of exercises, working out, they could have strains here. So muscular or soft tissue injuries are these. Joint issues are also common, which is the hip arthritis. As we saw the knee arthritis, hip arthritis is also one of the commonest problems which we are seeing in today's generation. The reason behind it, the hip is not being moved in all the ranges. We are just doing forward and backward, that is sitting on a chair, standing up, sitting on a chair, standing up. We are not sitting on the floor. We are not squatting, which is one of the most commonest reason why we are ending up with hip arthritis, because the hip joint is made to move. That is what we saw in the previous class. And if the movement is not happening in all the different angles, then those areas where it is not moving will start getting tight. Naturally, we have a door which we are not using. So by time when the days goes and the door is not opened and closed, the joints of the door will get rusted. Similar is the case with our joint. If in case you are not mobilizing or moving the hip to all the various angles, then the angle where it is not moving will get tighter. The structures will get tighter. And if the structures are getting tighter, very natural that erosion is going to happen. And erosion is going to happen, that is what is nothing but arthritis. So if in case you want to have better hip joint, keep it moving. I recommend that we all should squat completely, at least for 2-3 minutes in a day. Sit cross-legged at least 5 to 10 minutes in a day, so that the range is complete. The more you keep your hip joint mobile, the more you're going to be out of the risk of hip arthritis. Hip arthritis pains are more deeper. You'll feel it more inside. You can feel the pain which is more outer also at times, but the most common thing or the symptom is stiffness. Early morning stiffness could be there, which is you might feel like the moment you get up from bed, you're not able to move your hip. Or after sitting for a long period of time, especially after traveling, you'll not be able to stand up and move. Could be because of the hip arthritis. then you will not be able to stand on this leg. When you try to put weight on this leg, especially if in case you're standing on one leg, you will have symptoms of pain in this joint. So could be probability that you're having a hip arthritic issue. And how to differentiate it? The moment you start moving, the pain goes off. If in case this is the typical symptom of yours, that is like morning stiffness or stiffness after rest and gets relieved with mobility, that means you're having some sort of an arthritic changes happening inside it. If in case the pain gets more when you're walking or when you're doing an activity, that means there's some soft tissue injury which is increasing the pain when you are moving it. If in case you are at rest, the pain is not there, that means a confirmation that there's some sort of a soft tissue injury. The other combination injury is, of course, we also have a bursitis, which, as I was talking on the knee, that there are bursae that are on the knee. Similarly, here also we have bursae, again to prevent friction. So in case there is some sort of a pain, mostly if in case you are standing and this point exactly, if in case you feel pain here, it could be because of two reasons. Either there's a bursae here which is causing the pain, or the hip joint which is getting degenerated. You know now how to differentiate it. If in case in movement this pain is getting better, that means it's hip arthritic pain. If in case with movement the pain is getting worse, that means the bursitis pain. Okay, right. The next thing is like pain around the buttock, which could be because of the muscle spasm, and second thing could be because of the nerves which is passing this way. So what are these yellow things? These are your nerves. You can see that the nerves are coming out from each and every segment of the spine, and these nerves are supplying to various parts. And sciatic nerve, which is the common culprit for all our leg pains or radiating pains, are rising from this region, and they have to pass through the hip bone from the back and go to the leg. There is one muscle in this region which covers this part and are responsible for bringing the hip out, which is called the piriformis. The most common culprit for most of your sciatic kind of pain is your piriformis muscle, and it is called as the piriformis syndrome. What happens? This nerve has to pass through the muscle when it has to enter into the hip joint or to the thigh bone. At times during an activity or during some kind of a stressful movement, the muscle gets tight and it starts compressing the nerve in between. And if that is happening, then likely chances you'll have a typical nerve root pain or a nerve shooting pain. How to differentiate nerve pains? Nerve pains are mostly like sharp, they feel tingling sensation, numbness could be there, and you'll have a feeling of some insects moving around or something of that sort. So these kind of pain which you feel could be because of your nerve. And the piriformis syndrome is one of the most commonest contributing factor for your neural pain, which are generally misdiagnosed as discal pains, because a pain here which you feel will be leading the pain going down and it could lead the pain going up. So we need to really differentiate whether is this the structure which is causing the pain, is this the trigger point, or is it the epicenter of your problem, or is this the epicenter of your problem, so that your physiotherapist or your medical professional will be able to help you out in diagnosing that. But again, I'll be talking about the treatment parts in the next video, where I'll tell you how we can simply differentiate between the piriformis syndrome or if it is from the discal part of the joint. The other thing which we need to understand is structures inside. The pelvis is one of the most commonest foundation. As I told in the first class that ankle or feet is one of the foundations. The second foundation is the pelvis, because it is the pelvis on which the whole spine is being seated. If your pelvis is uneven, if it is front and back, then the foundation of the whole upper part of the trunk and upper part will get disturbed. So the structures which are here are mostly in males it is your bladder, in females it's the ovaries and the uterus, which becomes a major part of this area, and which also has your abdomen cavity. Now if any alteration in this can affect the placement of your urinary bladder or your uterus, and if in case there is any disturbances in them, can lead to some sort of a pain referred to the hip joint. There is a difference between radiating and referred. Radiating means the pain is in a line. It is from the origin till the exit point, the pain will be there. But in case of a referred pain, it means the problem is somewhere and the point which is shown up is somewhere. That means there is a victim and the culprit. The victim is someone else, but the culprit is somewhere else. So if in case the problem is there in your bladder or in your uterus, you might feel pain in the back, or you might feel pain in the hip, or you might feel pain going down, or you might feel pain in the groin. So these different areas should be clearly interpreted, which structures involved and what could be the cause for it. So again, your medical professional will be the right person to find out whether what kind of structure is involved. But from our point of view, I'll try to make it more clear, and I'll try to tell you how to differentiate whether the problem is from the internal organs or from the musculoskeletal system in my next class on treatment protocols. So guys, I think I have explained to an extent about the structures which can cause pain and what are the different ways in which we can differentiate them. So how to treat these problems and how to go about in handling those problems which you're going to see, we'll be seeing in my next class. Till then, goodbye, and don't forget to like and share my videos, because that is which is going to help me in making more videos for you. And if in case you have any specific issues which you want to discuss, or you want me to make any video on a particular topic, don't please forget to write it in a comment below, and I will try to surely make some videos on that. Thank you.